Good evening. Welcome to the Association for Popular Music Education webinar, Music Voices and Recording in the Age of COVID-19. I'd like to introduce Kat Reinhert, PhD, Contemporary Voice Specialist and President of the APME.
Welcome to our webinar. Thanks, Odie. We're so excited to have these wonderful panelists with us today. And I'm going to quickly introduce them and then I'll give it back to Odie. So we have Dr. William Schaffner, who is the Professor of Preventative Medicine in the Department of Health Policy, as well as the Professor of Medicine in the Division of Infectious Diseases at Vanderbilt University School of Medicine in Nashville, Tennessee. His primary interest is the prevention of infectious diseases, and he is a strong proponent of collaboration between academic medical centers and public health institutions. He has worked extensively on the effective use of vaccines in both pediatric and adult populations and has been a member of numerous expert advisory committees that establish national vaccine policy. Dr. Schaffner is the current medical director and past president of the National Foundation for Infectious Diseases and has served on the executive board for the Infectious Diseases Society of America. Thank you so much for being here. We also have Dr. Adam Lloyd, who is a voice pathologist and vocalogist at the University of Miami in the Department of Otolaryngology, where he works in voice care. Adam teaches courses on voice disorders at the University of Miami and Nova Southeastern University and is an active researcher in the field of voice with interests in outcomes of voice therapy and vocal pedagogy. He specializes in singing voice rehabilitation as well as transgender voice modification. Welcome, Dr. Adam Lloyd. Thank you for being here. And then we have Prince Charles Alexander, who is a recording artist and three-time Grammy Award-winning multi-platinum music producer, mixing engineer, and curriculum award-winning professor at the Berklee College of Music in Boston, where he created the commercial record production minor for the music production and engineering department. He also authored the master's level commercial vocal production and co-authored the bachelor's level vocal production course for Berklee Online, the vocal recording technology course for edX.org, and the art of vocal production course for Coursera.org. Welcome, Prince Charles Alexander. Thank you so much for being here. And we have not doctor yet, but almost, Odie Blackmon, who is a professor at the Middle Tennessee State University. And he's going to be, which is behind him, you can see, and he's going to have a few questions and open this webinar. So thank you so much for joining us. We're excited to have you.
Thanks, Kat. So I want to start out with some general questions for Dr. Schaffner. This started as this idea came from working on recording songwriting students in collaboration with the audio department at MTSU, and we were talking about having singers and musicians in the recording sessions this fall semester and trying to figure out how to do that. And so as I started researching different topics about COVID, a couple of things I wanted to ask you about in a more general direction. First, Dr. Schaffner, is I have found different opinions on HVAC as far as common used HVAC in different rooms spread. Some people say it helps, some people say it doesn't, and then also public bathrooms and how we're going to, deal with that on college campuses. Could you speak to those two issues?
Yeah, I can, Odie, but maybe I should just begin, first of all, by saying the only reason you've let me into this panel is, and Prince Charles will like this, my wife studied voice at Berklee, and my son has a degree from Berklee in guitar, but that's the way I got in the side door to this panel. Why don't we start at the beginning? Let me give everybody 5 minutes of a little bit of background of COVID. Coronaviruses are a large family of viruses. They're largely in animals. There are 4 strains that cause illness in people routinely. They just produce common colds. We get over them, and no big deal. But there are some, on occasion, one of these animal strains jumps species and gets into humans. There are 2 predecessors to COVID. One was called SARS, the serious acute respiratory syndrome, and then another one was called MERS, which was the Middle East respiratory syndrome. Both of those came to us via bats, one camels and the other one by a civet cat in China. So this is a third virus that has jumped species, come to the United States. It started in Wuhan, China, started in, as far as we know, a so-called wet market for animals, and that's where this virus went from an animal to a human. We might pause here just to realize there was one jump of one virus to one human being, and all the other subsequent human cases around the world have stemmed from that single introduction. It's an awesome kind of biological concept. Now, we won't go into all the details, but what we are learning about this virus, and we keep learning, is first of all, it is a very contagious virus. It spreads readily. It's a respiratory virus. It gets into our throats, back into behind our noses, gets down into our chest. It can make infection that is without symptoms, mild symptoms, or create life-threatening disease, the entire spectrum. I won't trouble you with all the details unless you want to get into them. We think, how is it spread? Because that's critical to this conversation that we're having. Given that it's a respiratory virus, the current best information is that it is spread by what we call droplet transmission. We think of droplets in lay terms, think of it more in scientific terms. These are droplets that are microscopic, but relatively large. So they don't travel too far, and that's where the 3 to 6 foot rule comes in. Most of these droplets, by the time they get out to 3 to 6 feet, gravity actually pulls them to Earth. But if you're within that range, and I exhale, and my exhalation has virus in it, you're going to inhale something of what I exhale, and the virus will go with it. That's what we think is the highway of transmission. Most of that transmission traffic occurs within 3 to 6 feet, indoors, with rather prolonged contact. Particularly in the last couple of weeks, there's been a lot of discussion about so-called aerosol transmission. That's when the particle is much smaller and can drift in the air at a greater distance. And perhaps at the margins of a room, somebody can walk in, doesn't come close to me, but can indeed inhale enough virus at that distant point to still become infected. The industrial engineers have shown us that's possible. We in public health and infectious disease acknowledge that it's possible. The question is, does so-called airborne transmission happen very frequently? So far, we in public health think not so much. Close in, that's the highway of transmission. Aerosol at a distance, that's kind of the side street of transmission. Yep, the cars get through, but not too many. So we really are interested in congregate, close congregate, particularly indoor activities over something of a prolonged time. I know you're all frowning because that talks about training singers, right? But that's what we think is happening. There are some people who cannot be identified. They don't have a green spot on their head or anything like that, who are super spreaders. Everybody's not capable of producing the same amount of virus. Somehow these super spreaders biologically shed, as we say, great deal of virus. And if you have a super spreader in your environment, they can infect a lot of people simply because they put out a lot of virus. Obviously, also, you all know this, I don't have to tell you this, when you exhale with force, if you cough, sneeze, sing, then you project, you give that exhalation more energy, and you can transmit it a longer distance. So even that close in range, given the activities you do, playing football, playing basketball, that can actually be extended beyond the 6 feet. That's not aerosol. That's just exhalation with more vigor. And you just send those particles out with more energy before gravity pulls them to Earth. I've mentioned people can be without symptoms. We think that accounts for somewhere around a third or maybe even more. And those people can be transmitters. That's at the whole root of why we recommend masks for everyone. That's to prevent me from transmitting it to you and the reverse. Yes, the masks also prevent some incoming, so I get some protection from you, but mostly the mask is to prevent me from giving it to you. And since I feel great, I could still have the virus. It's also, well, we won't go into that at the moment. So those are kind of the backgrounds. And now, Odie, to get to your point, there's been a lot of discussion, particularly with this airborne discussion in the last 2 weeks, about air handling and exchanges of air in rooms and whether air handling systems, particularly in public places, should be equipped with high energy particulate filters, so-called HEPA filters. They're more expensive, they require a lot of maintenance, and at the moment, you'll notice the CDC is not really recommending them very strongly, nor are we in public health, because we are not sure, we're not convinced that airborne transmission plays a huge role. And now you're going to remind me, the second part of your question was UV light?
Public bathrooms, and I was reading about the commercial toilets without lids and the virus.
Right. So in the beginning, there was a real sense that inanimate surfaces could be a major route of transmission. You put your hand on the inanimate surface, touch your mouth, and that's the vehicle for the transmission of the virus. All of a sudden, the virus is in me. So there was a lot of attention to disinfection and doing anything we can to avoid touching the inanimate environment. There's kind of a division of opinion in the infectious disease community. The CDC, with a lot of data, has kind of backed off that and said, you know, it's not as important as we thought. I have to tell you, I'm kind of in that camp, but I have very bright colleagues who can give you a good argument where they think the animate environment continues to be important. Where we come together, and so if you want to disinfect, please be my guest. That's great, can't hurt. Where we do come together is that the route from the inanimate environment to us are hands. So lots of good hand hygiene can interrupt quite effectively the route of transmission from surfaces to us. So we prefer to put the emphasis on the syllable of hand hygiene rather than being obsessive about the inanimate environment and disinfection. But if you like to do that, you can't hurt anything, and indeed you're helping to some degree. So further questions?
So the aerosols that are emitted from the toilets flushing everything, that's not a concern really as far as?
That is clearly not a concern. It is true that some virus can be recovered in stool, but we don't really think there are more than maybe 4 people on the planet that have been infected that way. I'm being facetious, but that's not something I would worry about. And you notice once again, the CDC is not saying hold it until you get home, right?
Yeah. I want to remind everybody out there too that you can type in questions, and we'll be getting to your questions for Dr. Lloyd and Dr. Schaffner. Dr. Schaffner, you mentioned masks, and of course, a lot of schools were requiring masks for our teachers and our students. I have these because of woodworking at home. Some of my friends have cloth masks. Some people are using the surgical mask. Does it matter? Is anything good? Is there better?
You can have a whole lot of discussion about that. The important thing is to wear a mask.
Okay.
And to wear it whenever you're in close contact with other people. If you're off bicycling by yourself, you don't have to wear it. Jogging by yourself, you don't have to wear it. If you're in a rehearsal room, rehearsing just by yourself, obviously you don't have to wear it. But as soon as you get close to people, inside particularly, wear that mask. And of course, now in Nashville, as you know, we have a mask order. You're supposed to wear it when you're out of doors doing anything.
Last general question, I read in an interview that you said gloves, not so good. This has been a few months ago, and I know for some of our studios, we're preparing to have gloves because people are touching knobs and doing all that. But you're saying as long as we're washing hands, don't worry about gloves?
Hand hygiene. Gloves are tricky even in the healthcare environment. You see, if the gloves become contaminated, it's just like your fingers. But gloves give you a false sense of security, and you start doing things with gloves on that you wouldn't with your hands. And of course, you're not washing your gloves while you have them on, and you don't change them all that often. Hand hygiene.
Yes, sir. Thank you. I'd like to move to Dr. Lloyd now. Dr. Lloyd.
All right, can you hear me?
Yep.
Wonderful. Good evening, everybody. It's a pleasure to be here tonight to discuss this very important topic. I want to thank the APME and Dr. Kat Reinhert and Odie Blackmon for their kind invitation to speak to you all tonight. I'm also honored to be in the company of Prince Charles Alexander and Dr. William Schaffner. As a voice pathologist, I'm concerned with professional voice users' ability to maintain good vocal health during this time, both for those without COVID and for those who have COVID or are recovering from this disease. This is an unprecedented time for all of us, and stress and anxieties are high. And as we know, emotional stressors can really affect the voice and the body immensely. Symptoms that may present as associated with stress and anxiety could be muscle tension, could be inefficiency with how we're using our breath coordination, and just a generalized decline in energy and excitement for creation of art and performing at a peak level. Many singers and teachers of voice are learning, practicing, doing webinars, recording, performing virtually, and we may continue to do this for the unforeseeable future. So I am seeing the majority of my voice therapy patients via telehealth, which is a great option to have, but certainly a lot different than what we're used to doing in person. I'm also wearing quite a bit of personal protective equipment when I'm out in the community, as well as with patients, and to varying degrees. And this really does present a challenge vocally. When we're speaking in kind of a muffled mask, we're not hearing ourselves as well, and we're not hearing other people as well. So it's kind of interrupting our feedback loop. And as a result of this, we may be vocally straining, and we could be experiencing vocal fatigue, which is a real problem for a singer. And so as we can imagine, when we experience vocal fatigue, this could also be contributing to damage to the vocal folds themselves and irritation, and perhaps even lead to formation of vocal pathologies like vocal nodules or some other traumatic lesion on the vocal folds. We're actually doing a survey now at the University of Miami, who's led by my colleague Jenny Lee Diaz, looking at how virtual communication and usage of PPE are affecting the voice. So hopefully we'll have some results on that study in the next couple of months. I do want to touch a little bit on our speaking voice. And I think it's important now more than ever that we establish and maintain a well-coordinated and functioning speaking voice technique, especially given all of the protective equipment that we're wearing and communicating virtually. It's good to develop what I call good self-monitoring skills. So if we notice that we're speaking with more vocal effort, we're speaking at a loudness level that we're not really comfortable with or used to doing, we have to be able to recognize that and scale that back so we can mitigate symptoms of vocal fatigue. So doing something as simple as like a short 1 or 2 minute vocal warm-up our vocal function type exercise for your speaking voice specifically can help to set you up for success in continuing to establish a good communication vocal abilities throughout the day. So something similar to this. Doing that a few times in a comfortable pitch, comfortable loudness, as well as maybe gliding up and down in a comfortable vocal range for speaking. So something similar to this for me. We call this like a resonant voice. And with a resonant voice, we're feeling a sensation of airflow, not pressed airflow, but we're feeling easy airflow, feeling a sensation of vibration and a lack of strain and tension in the throat muscles, which is very important. I think I would love to hear Dr. Schaffner's opinion on this later, but I think it's too early to really know what COVID-19 is going to mean for us in the long run vocally for people who've had COVID-19. We are certainly seeing patients in voice clinic who've had COVID that are describing decreased respiratory function, which is not surprising, change in the sensation inside the throat, whether that's a more hypersensitive throat, whether that's decreased sensation in the throat, as well as continued coughing and throat clearing despite having recovered from the virus. And as we know, some of these behaviors, particularly coughing and throat clearing, which are done with the vocal folds, can be extremely irritating to the tissues of the vocal folds, and it can even contribute to structural pathologies. So I think it's very important at this time that we really emphasize maintaining good vocal hygiene. So vocal hygiene really has to do with what we put into our bodies, our vocal behaviors that we present, as well as the types of things that we're exposed to that could affect the throat. So maintaining adequate hydration, and it's really difficult to maintain adequate hydration when you're wearing a mask all day. So if you have a job where that you really don't take your mask off much, you're not going to be drinking a whole lot of water. So we've got to figure out how to get that water in there to maintain good hydration, especially if you're wanting to use your voice as a singer. We want to try to reduce and eliminate habitual coughing and throat clearing, as well as reduce excessive loudness. And also, I really want to emphasize finding those times throughout the day where we can take vocal breaks. Maybe you call it vocal nap, especially if you've got things that you have to do vocally that day. It's also important to get control over other irritants that may affect the throat, such as allergies and reflux and other possible irritants from the environment. So working with your doctors to really make sure you get a handle of those types of things. And also, Dr. Schaffner, if we have time, I'd love to get your opinion on nasal breathing and how the nose is kind of a filtration system. And at least in my experience, it does help to mitigate some dryness effect, but I'm curious as to your thoughts about the perhaps bacteria and viruses that get through the nose versus the mouth. There's a recent article that came out in the Journal of Voice from a multidisciplinary group of voice professionals, including physicians, speech pathologists, voice teachers, that summarizes how the virus spreads, which with Dr. Schaffner did very nicely just now, as well as specific attention to singers and perhaps mitigating some of that risk. This article is titled Safer Singing During the SARS-CoV-2 Pandemic, What We Know and What We Don't. It is free as open access from Journal of Voice, and we're actually going to post this into the chat so you can link directly to that article if you want to check it out. The authors emphasize that these recommendations are based on weak scientific evidence and what they say as common sense. So although this may mitigate some risk, it does not eliminate risk. So some of the things Dr. Schaffner already mentioned, but keeping a physical distance is important, more than 6 feet as a minimum. Rehearsing outside if you're able to. Rehearsing or being in well-ventilated spaces. Using PPE. So that might mean performing and singing and rehearsing with masks on, which would be odd, but if that's what we have to do, that's what we have to do. Rehearsing alone, rehearsing in small groups or shifts, and shortening rehearsal times, as well as eliminating extracurricular activities with each other, such as going out to dinners and taking breaks in the same locations, wiping down surfaces, which we've already talked about, as well as perhaps screening for symptoms. So if you're a leader of a large ensemble, having somebody at the door as people coming in, screening maybe perhaps temperatures or asking if they're having any of the typical COVID-like symptoms. Avoiding direct contact with each other, so no touching, and practicing meticulous hygiene. And last but not least, and this sounds obvious, but if you have any symptoms, don't come to the rehearsal, right? Again, this article is available open access, and I thank you for the ability to share my thoughts on this, and happy to take questions later. And I think now we're going to hear from Prince Alexander.
Thank you, Dr. Lloyd. Thank you, Kat. Thank you, Odie. Thank you, Dr. Schaffner, and thank you everyone that's attending today. I'd like to go through a series of questions that Odie posed to me. As a producer and an audio engineer, I spend a lot of time in small spaces. I've been doing that for a couple of decades now. So some of the transition doesn't feel totally uncomfortable for me. Some of the, hunkering down and being in one space. But at the same time, I'm at a school, I teach at Berklee College of Music, and we have 600 faculty and 4,000 students, and everybody wants to get into the studio. So one of my concerns, my big concerns, is that, I'm of that age and I'm African-American and I might potentially be able to catch COVID. So I've been really attentive to, wearing masks almost from the beginning. I've been doing 6 feet of spacing, but it seems like the country's getting more relaxed. And then what's going to happen when we come back to school? When will the students get comfortable and start to commingle with each other? And then once we're in the studio, we start to get a little bit too close to each other and maybe pass things around. So we have discussed some guidelines at Berklee, and I'd like to share some of them with you. We will be following some strict adherence to new room population limits. There are normally 8 students in the control room with me, and if you know a studio control room, it's not usually a big place, which is different from the actual studio itself. So we will be changing from 8 students and 1 faculty member to 2 students and 1 faculty member. And the other 6 students will view remotely, and then they'll do a round robin where 2 come in the next week and 2 come in the next week. That's one of the discussions we've had. Some people think that even 2 in with the faculty member might be too much. One of the things to consider is that you need to be in the center of the stereo field. So if there's 2 speakers up, the teacher might be in the center of the field and 1 student might be in the center of the field. Then you put a 3rd student there. It's like, okay, how deep are we getting? So this idea of having 1 faculty member and 2 students is an interesting idea. I'm not sure that we've really flushed that out down to its final view yet, but those are the things that we're discussing. Each studio will be equipped with hand sanitizer, mask, and rubber gloves. And I was just listening to Dr. Schaffner talk about rubber gloves. And I'm like, okay, I'm going back to the meeting and I'm gonna tell them no rubber gloves. But so we will be using the hand sanitizer, putting on the mask and the gloves. Do not touch the face, do not remove the mask or the gloves while in the studio. Try to avoid leaving the studio until the end of the session, as you will need to re-hand sanitize and re-glove. Musicians will be entering the studio. They'll have to hand sanitize and wear masks, but not gloves because they need to play their instruments. We have 16 studios that we have to manage. We've got Neve consoles, SSL consoles, Avid consoles, API consoles. 14 of the studios have consoles. And I mentioned consoles because each one of them has faders, small rotary pots, potentiometers, and buttons that people are touching. With gloves or without gloves, there's a lot of risk at being able to transfer COVID via touching the faders, touching the face, and so forth and so on. So that comes to, how do we clean the surfaces? They're very, very tiny, minute surfaces, and I'm glad to hear you say that that surface area is not as big a consideration, that hand hygiene is going to be very important for us. We also have outboard gear, the patch bay, patch cables, things that will dial in EQ and compression for the gear. We have instruments like pianos, Steinway, Bosendorfer, Yamaha pianos all over the place, like not even just the studio pianos, but all over Berklee, there are pianos. After each session, we will leave used accessory items other than mics, and things like cables, mic stands, chairs, headphones, and gobos, those things that separate musicians from each other, in the center of the room to be sprayed and wiped down and put away by the studio session transition team. I don't know who that studio session transition team is, but that's going to be a very, very important piece of making sure that things are sanitary. Headphone ear pads and headbands will be wiped but not sprayed. So if the headphones are going over your ears, they'll be wiped but not sprayed because they have condensers in them, little condenser transducers in them that could be damaged by any type of liquid. Additional options would be to limit the use of personal mixers. So when you're in the studio, you have a personal mixer. There's like 8 faders on the Aviom console, so you can do your own drum mix and bass mix and piano mix and vocal mix. Those would have to be sanitized. Our chief engineer at Berklee and their tech team are exploring UV solutions. And I think that's one of the questions that I might have for Dr. Schaffner. So we're looking at wands to sterilize some of our equipment. But would UV light, you know, maybe irradiating the whole room be something that we could potentially invest in? That's something that I personally have been thinking about. And given the above precautions, we're still not sure whether that would be session by session, because each one of our sessions is like 2 to 4 hours long. So would we do that for every session, or would we do those sanitary procedures once a day? You know, we're still working that out. Our in-session protocols, this is really interesting. Ensembles will be limited primarily to trios or quartets, larger depending on studio size. And to ensure possibility of social distancing, that's why we're keeping the population small. Musicians will need to provide their own instruments, makes sense, other than the piano or other large orchestral instruments like the marimba, the vibes, and the timpani. The piano must be carefully wiped down, not sprayed directly between sessions. These pianos are very, very sensitive. Like I said, Steinways, Yamahas, if you're putting liquid on them, you can potentially damage the action. We will need to investigate best practices as we move forward in the school year in September to really find out how efficient all of these concepts are. Singers and brass and wind instrument players, there's a lot of aerosol going on. There's a lot of spittle going on, dropping on the floor, even from the floor splashing up, and you know, all types of things. So singers will need to provide their own mics. Like vocalists might need to bring a Shure SM58. Internal windscreen, so no pop filter used. So we're not going to use the regular pop filter that's about 3 inches away from the microphone. There'll be microphones that have an internal windscreen. Clips on mics are popular for brass instruments. Those are the little remote microphones, if it is deemed safe to have those even in the studio. The sessions will not be booked back to back. Extra time is going to be needed. 30 minutes minimum will be needed to sanitize and provide an additional buffer for social distancing. That's going to interrupt the entire flow of our classes. It's 2 hours, 2 hours, 2 hours. So now it's going to be maybe an hour and a half an hour to clean, or 2 hours, a half an hour to clean, which is going to throw the whole schedule off. So investigating these has been really a serious consideration for us at Berklee College of Music. Musicians will hand sanitize, mask, go straight to the live space, and remain there. They will not enter the studio control room where the engineers will be. Playback will be over headphones or studio speakers. So there will not be that interaction where you can come in and listen on the large speakers if you're the musician. The recording class protocols to maintain social distancing, faculty will designate, this is interesting, and I'll just give it to you because it's something that we discussed. To maintain social distancing, faculty will designate 1 student to capture the class on their smartphone for streaming, and 1 student assistant for control room like patch bay and the machine operation, and 1 or 2 student assistants for the live space. The rest of the class watches class remotely, and roles are reassigned each week. It still sounds like it's awkward that one of the students is not really participating as a student, but as the camera person for the class. This is still something that's in the works. And there will be no visitors allowed in sessions outside assigned performers and production engineering personnel, and musicians do not come into the control room. Another question that I was asked by Odie, what opportunities are there in this environment? There are plenty of opportunities for mixing engineers, and I would say like editing, things like choral choirs. You've been seeing people, you know, like there's 15 people singing on a screen, everybody in their own little pixel. Well, that has associated audio. So audio engineers are learning things like Premiere and Final Cut in order to put those projects together. You can probably even do it in iMovie. So there are opportunities. I know that some of the church engineers, their opportunities have exploded because there's no choirs right now and all the choirs are doing things remotely. That means that you have to understand syncing concepts where one person has the reel, the music reel, they send it out to other people sing, they've got to go under headphones and perform their part against the music reel, and then all those come back to one person that has to synchronize them up. If there's anything that goes wrong in that process, that could potentially throw off the entire project. I think that is the biggest opportunity I've seen in this space, because live performing has definitely been gutted. So mixing engineering, I've actually gotten more mixes that have been asked of me. Unfortunately, I don't have the large studio monitors to listen to my mixes, but I'll tell you, I've been transitioning anyway over the last 10 years to being able to listen to my work on computers and on, I have Yamaha HS5s. So the small space for listening, our industry's kind of been moving that way anyway. So if you're on the mixing, monitoring side, editing side, there's probably more and more opportunities. If you're on the recording side, honestly, even at Berklee, we haven't figured out how to do this well without having 1, 2, or 3 people in the room. What might singers need to just get up with a basic recording system at home? Well, you should have some type of a recording software, either Pro Tools or Logic or Ableton Live. Those are the big 3 that we use. I know some people use FL Studio, other people use Reason. So have a recording software. You're gonna need a microphone. I don't know if anyone should spend more than $200 or $300 for a microphone. The best microphone on the planet is the Sony C800G because it's got a cooling system in it. Those things are like $10,000, $15,000. You do not, please don't spend $15,000 on a mic right now. A very, very good microphone at about the $1,000 range, which is the entry point for excellent microphones, is probably the AKG C414. I just recently bought an AKG P420. The reason that I bought the P420, and any microphone that you get, pay attention to the pattern, the polar pattern. There is the cardioid pattern, which is the normal microphone pattern. But there's also the omni pattern and the bidirectional pattern. So I purchased the P420 because it's a $200 microphone that has those 3 different patterns. There are reasons why you would want to have access to those 3 patterns if you're recording guitars, pianos, or other than your vocals. So look for a microphone in the $200, $300 range that has 3 polar patterns. That's probably going to be pretty important for you. I don't know if you really need to spend any money on speakers. If I can listen to a great song and it sounds amazing coming off of my computer, then my work should sound amazing coming off the computer. And I think the more you practice that, the more you work on the dynamics of making your music come to life in these small transducers, it's going to be a benefit anyway when you get into a large speaker environment and it can actually hear everything. And I think that maybe covers most of what I need to kind of give you in terms of some of the thoughts and the protocols that we've been looking at Berklee College of Music.
Prince Charles, let me just say that speaking of the brass and wind instruments and spittle, we have a link coming up in the chat section right now from University Medical Center Freiburg in Germany in collaboration with the government. They did a study on that. And then another link to University of Colorado Boulder's Engineering and Applied Science Department, that a current study that's going on. That'll be information for everybody that's watching. Dr. Schaffner, could you answer some of these questions from Prince Charles, like the UV wand and the other things?
Sure. Well, very quickly, UV light has been used in the past in the healthcare environment to, if not sterilize, certainly de-germ air. A couple of things about UV light. One is you have to mount it up close to the ceiling because you can't look at the light directly. you may get retinal damage. So you have to shield the light from casual people. You have to be careful about that. You have to make sure that your air conduction in the room actually passes over those lights. Otherwise, the light is not effective. And then the third thing about UV light is that the bulbs get dusty very quickly, and that reduces their penetrance and their effectiveness. Wow. So they require a lot of maintenance. Short story, they were of great interest in the healthcare environment about 20 years ago. We don't use them very much anymore.
Wow, I mean, that's just, there's so much information. I'm listening to all of the people talking and I'm just like, wow. And we have a lot of questions. So I want to go back to, I'm going to kind of moderate the questions as they've been coming in. Raina is helping me in the back and she's awesome. So I want to go back to Adam's question about nasal breathing for Dr. Schaffner versus like mouth breathing. And I've been reading this book called Breath, which is really fascinating. I don't know if you've heard of it, but it was just, yeah, just thinking about like, what is the difference and how might that help versus, you know, breathing through your mouth? Does it make any difference?
Yeah, so Kat, it probably makes some difference, but not enough to make a big difference, if you understand what I'm saying, because those viruses can get through to your nose. Although I will tell you, some people have focused very much on trying to develop nasal preventatives so that we can prevent COVID infections. None of those have come through yet with enough scientific study.
Okay. Wow, that's a lot. Adam, did you have any follow-up question to that?
Let me look back. I think I was keeping, so come back to me.
Okay. So for either for Dr. Schaffner or Adam Lloyd, there are questions about singing in the same room, whether it's two people or if it's a choir, or a class for musical theater. What are maybe are there any general protocols for that? How far do they have to be? There's questions about does wearing a mask or a face shield, is one easier or better or worse than the other one? So I guess those three questions, like what's the distance that's recommended if two people are singing in a room? Is there a safe distance? Number two would be if there's more, like a big classroom of a choir or a musical theater class, what would be a safe distance? And then do masks and face shields like help in those situations?
Shall I start?
Please go for it.
I'll start and then Adam can chip in.
Sure.
First of all, Kit, with all due respect, I don't like to use four-letter words like safe because that suggests absolute safety.
True.
And what we're trying to do is reduce risk. We're all adults here. We know that in order to be safe, we stay home, lock the door, and wrap ourselves in saran wrap. That's safe. Anything else, once we get out that front door, we acquire some risk. So we're trying to reduce the risk. As was mentioned, either by Adam or Prince Charles, screening with either temperatures or symptomatic screening, you have to educate your students to be honest about that because there will be a great desire to come and practice regardless, but they're putting other people at risk. So you have to educate them about that. Maintaining as much distance as possible. I'm not an expert at singing through a mask. I will leave that to all of you. Of course, that would be better than singing naked without a mask, right? Because the exhalation will go much farther. So a series of things like that. Sometimes schools have been able to pay some attention to their air handling and get more air exchanges in the room, which makes it a little bit more like the out of doors because you have a greater dilution factor. That's not always easy.
I have to weigh in on this because the nuance of capturing vocal performance has been worked on since 1878 and been getting more fine and more fine in terms of being able to do full frequency response. Singing with a mask is totally counterproductive to the recording process That,
Sure.
if anybody wants to do it, fine, go ahead. But it's not going to be a nominal performance practice. So distancing is going to have to be something we're looking at, 12 feet, 18 feet maybe. But, you know, even at 18 feet, if there are 2 or 3 people, I'm not even thinking about 20. If there are 2 or 3 people in a relatively large room for an hour, let's say, I just don't see how the aerosol in the room is not going to touch each one of them. So I don't know, maybe I'm being a little paranoid, but I do know that the mask is not going to be great.
Right, yes. So just a footnote, and I'm giving you maybe previews of coming attractions, and I'm going a little beyond what I should say. I'm on a consultative committee with the National Collegiate Athletic Association. And just as you're interested in singing, they're interested in football, contact sports of all kinds, basketball. And that group, I will just say, has become incredibly sobered over the last 6 weeks, as we have seen the dissemination of this virus out of control over much of the country. And just let me say that that, along with the limitations of testing, has really sobered that group. They're in the process of making recommendations, but the fall of the year may be different this year than it has been in the past.
Just to add one point to that, I think it matters the type of voice that you're producing. So as you mentioned earlier, Dr. Schaffner, the more you're blowing air out, the more the droplets that you could potentially be spreading and the further they may be going. So if you're doing louder music or louder vocalizations, that might be at more of a risk for spreading versus something that's softer and a little bit more well balanced in terms of the vocal fold closure and not contacting too hard and spreading a lot out, and perhaps.
Okay. Thank you for all those great answers. There was another one, and Adam, you and I were talking about this, and I saw some of this talked about on the National Association of Teachers of Singing webinar that happened a week ago. But some of the difficulties that singers may experience post-COVID infection, like, you know, there's kind of emerging, I think, evidence that it does affect a longer term than just the virus being in the body. So could you speak to that, or Dr. Schaffner?
Yeah, so just from
Go ahead. Yeah, go
sure,
ahead.
just from a standpoint, yeah. You know, so obviously the major concern here is, you know, the 3 subsystems of voice production. And the first one is respiration, right? And so if our ability to breathe is affected, that is going to affect our ability to sing. And when we have, let's say, a weakened respiratory system, we're going to try to work harder, and that can lead to maladaptive behaviors in the singing and can cause voice problems. So that would be sort of my take on that.
Do you have anything to add, Dr. Schaffner?
Not really, except that we are learning more about the long-term effects of COVID, and that many people, particularly who have more severe illness, are left with fatigue that can last a month or longer, headaches, joint pains, aches, not fever, not signs of active infection, but just long-standing kind of a disability, and sometimes even a sense of fuzziness of thinking. I was almost taking notes when Adam was speaking before. He was teaching me a lot here because he's seen some patients like this.
Yeah. Another question we had was about singing with a mask on and how to breathe. Like, is there how to get more efficient breaths? Is there any way to do that? And a question that I've had to deal with too, because I wear glasses with a lot, which is like how to keep your glasses from fogging up, which isn't, you know, totally, but I know it's a thing. And I think some of us, like, you know, how do we, you know, how do you do that?
I don't think
it's frustrating.
I don't think any of us are experts at singing with masks on, nor do we want to be. But, you know, I think that we can breathe, you know, most of us can breathe perfectly fine with a mask on to get through our daily tasks. And we'll be able to get through it with singing. It may not be optimal, but we can do it. And in my opinion is regarding the face masks and not fogging the glasses, because I wear glasses every day, is you have to have a good seal along the bridge of your nose. Otherwise, and maybe around your cheeks too, otherwise the air is going to come up and heat your glasses.
I'm already brainstorming how Prince Charles and I can invent a pop filter style singing mask and maybe go on Shark Tank or something.
I love it.
Dr. Schaffner, I wanted to ask, with what Prince Charles was talking about in sessions we're setting up at MTSU, so if the scenario is an engineering teacher, 2 students in the control room, we're talking about having musicians in isolation booths, drummer in the main large room, and instead of coming in and hearing the mixes between takes, just staying out in their ISO booths and listening to their headphones, maybe using 1 singer per session so that we don't have singers coming in and out of the same vocal booth. I know you don't want to use a 4-letter word, so I won't say safe, but is that a pretty good plan?
Well, Odie, I think you're being very thoughtful about it. And it just reminds me of all the kinds of adaptations I hear people talking about, not only at the college level, but at the grammar school level and in kindergarten, for example. They're trying to figure out how they can reduce the risk, recognizing that there's nothing perfect. But if I understand what you were saying, I was trying to, plan it out in my mind as you were saying, that's about as careful, I think, as you can be. Put attention to hand hygiene, make sure that nobody comes into those sessions with any kind of symptom, and good hand hygiene on the way out.
Great.
And I think we have,
I
sorry.
wanted to weigh in a second time about the masks. The production and engineering process is really a fine-tuned process, and we can literally hear tissue in front of a microphone. We can hear the degradation of the frequency response. That's how fine the listening is in a recording studio. So I just, thanks again for that question. And I know that people are really trying to figure this out. I just don't see how that's doable, though.
Right. I mean, it seems like one way to go would be to equip students with equipment at home that they could record and send in. I mean, I've been doing work like that from home too. I bought a nice mic and a pop filter and Logic, and you're sending things to people and they're doing what they do to them. And I mean, it's an interesting place to be, as you said. Like, there's opportunities too for if you think about those things. But then going back to what Odie was talking about, and I think this is going to be almost our last question, but like, if a person is in a room either singing or playing an instrument and they leave that room, like, how long does it stay in the environment? And like, is there, what would be a recommendation for when the next person could come in, whether it's a recording booth or a classroom or a practice room, or like, is there a recommendation for that, or is it just we don't know yet?
Kat, we don't know the answer to that. And as you can imagine, the environmental circumstances are going to vary from smaller spaces, the amount of air exchange in that room, and all of that. But it does go to that question we talked about before, the droplet close-in transmission versus the airborne. And at the moment, unlike measles, where the person with measles can leave the room and somebody else can come in 2 hours later and acquire infection. That's how contagious measles is. COVID is not that contagious. And so many of us don't think that airborne transmission, that it lingers in the air in an infectious dose. You have to get enough of it to make you sick, right? And we don't think that really happens all that much. Talk to me again in a month, and I may have had to change my mind. You know how these things work. But that's kind of the public health concept at the moment, and that's why there are no clear guidelines about how long rooms have to rest between uses.
Right, and I think that's part of, why we're hosting this and why we're having these conversations, is we're trying to figure things out and help people as we can as we're moving through this. And it is going to change. And I think that's something I think everyone is wrestling with is like, we just have to be open to that these things are going to change and we're going to learn more. And as we learn more, we can adapt. And how to do that as effectively as possible, I think, is what we're here to talk about. So thank you. I'm going to turn it back to Odie. Yeah, any final things or any of the panelists want to share before we sign off?
Any final thoughts?
Stay safe, everybody. Best wishes.
I saw
Dr.
a
Schaffner?
question.
Oh,
Oh,
sorry.
I saw a question somebody asked about the best free recording software. I know that when you buy a Mac, you get GarageBand. It's a great tool, and there's another piece of software called Audacity. So those are probably the best that you don't have to spend a lot of money on.
Thank you. Dr. Schaffner, Dr. Lloyd, Prince Charles, thank you for joining Kat and I, and on behalf of the Association for Popular Music Education, thanks to everyone that joined us tonight, and hopefully we answered some questions, and we'll have a great fall. Everyone have a good night.
Thank you so much.
Night, everyone.
Thank you.
Thank
Thanks.
you, Odie. Thank you.